around whether which plans and Medicare and elsewhere will it cover so-called quote preventative service. And what I say is the jury is still out, because none of those changes are supposed to really kick in until 2014. And while they can claim it may and will, it's supposed to cover certain preventative and diagnostic tests. Some other group is going to determine which of those tests it might be. And like any good speaker, I take the question anyway, answer any question I want. So let me take that bit and to say there's another reason why that's such a big area of real concern. Many of you may have remembered the mammogram brouhaha back in November, where the body that was suddenly going to be empowered to determine whether or not people could get access to mammograms between ages 40 and 49 said that it's not worth it. Even though the data that they were working on was old, and it's fair to say that at least 15,000 American women's lives have been saved in recent years because of that. So they did what made sense, right? Which quickly put together an amendment that, quote, addressed the problem. Well, how did they address the problem? They just added another bureaucracy to also have responsibility for dealing with the problem as well. I don't know how that solves it per se, or how that will create more conflicts in the future. But most importantly, look, when the president started this process, he said he wanted to do things to increase access to care, to decrease costs, and increase quality. And I'll be the first one to raise my hand and say, I agree with him. The bill and the law doesn't do that. And what they failed to do with the so-called Mikulski Amendment that addressed the mammogram issue is they did not bother applying it to anybody who gets care under Medicaid. Well, the way they, quote, cover 32 million people is by sticking 17 million of them into Medicaid. So the folks who are in Medicaid, which will be an ever-increasing number of the population, will find themselves with even fewer choices. And to delve even further into a question you asked, the way the bill was written, it is easy to interpret it that the bill explicitly limits cost sharing for certain prophylactic and preventative tests and services. Well, cost sharing means any money out of your pocket, which means that if it ain't covered, there's a very good chance you will not be able to spend your own money today. Now, they'll never put it that way, because they'll say you can still get the test, but the people providing it just can't accept any money for it. So they won't say that they're doing that, but that's actually in the language of the bill now. Sure, way back